This is the Lone Crater YouTube. We hope this video helps.
You should stop and not attempt hot compression or home drainage. You're making a decision to prioritize safety. Inspect the cyst for increasing pain, spreading redness, fever, or drainage. Once you notice any of those signs, avoid manipulating the area and do not apply heat that you cannot precisely control. Instead, clean gently with soap and water, cover with a sterile dressing, and contact a licensed clinician for in-person assessment and next steps right away. You'll be advised that definitive care is performed by trained clinicians. They'll explain why sterile technique matters and how they use local anesthesia and controlled instruments to drain or excise a cyst safely. Once in clinical care, expect possible imaging like ultrasound to define size and depth, and cultures if infection is suspected. Antibiotics are prescribed only when indicated. Make sure to follow their post-procedure wound care instructions rather than improvising at home to prevent complications. You must follow the clinician's written aftercare. Keep the site clean, change dressings as instructed, and take any prescribed medications. If swelling, increasing pain, spreading redness, red streaks, fever, or new drainage develops, contact your provider immediately or go to the emergency department. If you're uncertain about signs of infection, call your clinic. Do not attempt further home interventions. This single precaution reduces risk and ensures proper treatment if complications arise.
Thanks for watching. Consider subscribing if we helped you.